Hi, welcome back to my channel. In this video, I will be talking about Bionator. So, if you see that Bionator is somewhat similar to a activator. So, Bionator was developed because of the disadvantages of activator. So, the disadvantages of activator was something like it was bulky. Then it was because it was bulky and so it was limited to night time. Then it also had minimal function during sleep. All right, now if all of this to overcome all of this, we came with the idea of Bionator. So Bionator had advantages like it was first as known, it was less bulky. Second, there was narrow lower portion and lateral extensions for better fit. Then it had a cross palatal stabilizing bar, and also it has buccinator wire loop. This inhibits the muscle deformation, and the cross palatal bar is for tongue proprioception. Now let's talk about proprioception. Now let's talk about philosophy. So in philosophy of a Bionator, if you see that it mainly emphasizes on the relationship of the tongue and the muscles. So it says that the philosophy, it says that the equilibrium, so philosophy, it says that the equilibrium of the tongue and circumoral muscles is responsible for dental arches, and the functional space for tongue is responsible for the development of orofacial system. Development of orofacial system. Okay. Now let's talk about the various types. So the types are easy to understand. So for types, talk about here. So in types we have three types. So one is the standard appliance, which is indicated for class 2 malocclusion. Then we have the class 3 appliance, or it is also called as reverse Bionator. And third one is our open bite appliance. Alright, now let's see them in the photograph. So these are some pictures that I've taken from Balaji. So let's see the standard Bionator. So in standard Bionator, you will see that we have an acrylic plate over the maxilla and the mandible. Then there is some important points that you should know, that the palatal bar, this palatal bar, it is directed posteriorly. All right, and you will see that in the other one there's a difference. All right, so in the standard appliance, you what all things you have is you have an acrylic sprint, and it extends from molar to molar. Then you have a palatal bar, and we also have a labial bow. Now this labial bow is to protect the upper incisors from the forces of the lip. All right, now let's see the other types. So in this next type here, yeah, so see, the first one is our class 3 appliance. Class 3 appliance. Now in class 3 appliance, you have to see the palatal bar. See, in this one, our palatal bar was directed posteriorly, right? But if you see in the class 3 one, you will see that the palatal bar is directed anteriorly. This is the main difference. And there's the difference of the labial bow as well. So class 3 appliance, in this, what we see is that the palatal bar, palatal bar is directed anteriorly, alright, so that it acts as a tongue shield. Now look at the labial bow positioning. Now see, here we had labial bow over the upper anteriors, right? So see there, here we have over maxillary anteriors, but here you have the labial bow around the mandibular anteriors, alright. So it's basically the opposite of our standard appliance. Now let's talk about the third type, which is the open bite appliance. Now open bite appliance is somewhat similar to the appliance that we have as standard appliance. The only difference is in the labial bow positioning. Now in the labial bow positioning, see the palatal, first of all, just observe the palatal one. It is same that it is directed posteriorly, right? So directed posteriorly. What is this? This is the component is palatal bar. Alright, now let's talk about the labial bow. In this labial bow, you will see that it is over the incisors only, but it is not over them, right? So this is basically erupting incisors, and it basically to guide them, right? All right, so now so this is used for class 3 and open bite for open bite cases. Now let's just go through the differences once again. In this, palatal bar was directed posteriorly, here anteriorly, and here posteriorly. Labial bow over maxillary incisors, in class 3 over mandibular incisors, and this was like near the occlusal surface, right? So yeah, open bite cases. Here sometimes there's the difference between acrylic plate also. Sometimes the acrylic plate is modified so that anteriors are also covered. So now if you talk about the philosophy again, now all of these appliances the use is based on the philosophy only. See, he said that we need the equilibrium between tongue and circumoral muscles. Now there were certain things that Bolters, see, first of all, given by Bolters. There were certain things that he told. He said that the open bite case is occurring because of the thrusting of the tongue. So according to Walter's Bionator philosophy, these are some things that are like common sense only, but let's just talk about them. So in this, he said that the class 2 malocclusion is due to the posterior displacement of tongue. Then he said that the class 3 malocclusion is due to the anterior and low displacement of tongue. Alright. Then he said that the open bite is due to the hyperactivity and forward posture of tongue. Then he also said that the narrow arches and crowding is due to the low outward pressure of tongue. Alright, so these are some things that you can remember, like obvious things. Now let's just talk about the contraindications of Bionator. Just write it in a better way. So contraindications. Now in contraindications, it is contraindicated in class 2 cases. that are due to maxillary prognathism. Then vertically directed growth, labial tipping of mandibular incisors, and in crowding cases. So this is Bionator. If you like the video, do subscribe to my channel. Thanks for watching. Give it a like, comment, share, subscribe. Yeah, thanks.